All right, good morning or good afternoon or good evening, depends on when you're watching this video. So like I said, some persons actually chatted me asking me different questions, and I felt I need to just address these questions on the video. Okay, so if you feel that these are the same questions you want to ask me, then this is fine, you can just go ahead to watch. Now
let's have it.
The questions, this particular question I'm addressing is, what are the symptoms of diabetes? Now, diabetes is broad. If I want to talk about the pharmacology, the pathophysiology, and what happens that diabetes occurs, it's going to take a lot. Okay, but I just want to do something brief. So diabetes basically is increased blood sugar level, okay, beyond a particular range, right? Usually beyond 126 milligram per dl. All right. However, there are some symptoms that you can know. Oh, I need to go do a checkup to see if I have diabetes. For example, frequent urination. If you are urinating too frequently, now we're in rainy season. I made this video during rainy season, so if you are watching it in dry season, it's fine. So there's a chance that you may want to, that your body will want to release out water more during rainy season. The reason is because the weather is cold, there's not enough sweating, and you are taking a lot of food and water at the same time. So the body has to release a lot of water because you already have enough in the body that can sustain the body. You should not be scared.
You for talk am since now.
Okay. However, the frequent urination we are talking about here is that at every interval you are urinating and you are thirsty at the same time.
They have failed!
Failest.
Okay, so it's not like your body is having enough water. Your body does not have enough water, and your body is releasing too much water. So you are thirsty, frequent thirsty, like feeling thirsty too frequently is also a sign of diabetes. Frequent urination is a sign of diabetes. And it's also the idea of sweet urine.
Hey!
Although it's quite gross, but many persons taste their urine to see, but don't do that. Okay, there are more advanced way to check if you have increased blood sugar. Then there is increased hunger. You just want to eat. So those are particular signs of diabetes. Then there is tingling in the legs and hands. You understand, the external extremities. You're feeling this tingling sensation. You understand. Those are basically most of the frequent symptoms that people who have diabetes they experience. So if you are feeling any of the symptoms, just walk into a pharmacy, walk into a laboratory. I think a pharmacy will be able to do a blood sugar test for you because they're quite most of these basic tests. Then usually the results are arranged or are classified in two ways. There is the fasting blood sugar. Now fasting blood sugar are for those persons who have not been diagnosed initially and they just want to check if they have either they are okay or they are under pre-diabetes range or they already have diabetes. Okay, there's a range for these figures. They are calculated, they are graded. Okay, then fasting blood sugar will guide you to know how your body handles sugar after about a period of 8 hours. Okay, then there's random blood sugar. Random blood sugar usually for patients who have already been diagnosed with diabetes and they just want to see the range of their blood sugar over the period of time after they eat. You understand? Because sometimes after they eat, sometimes some of them use insulin injection for their diabetes, and then sometimes that insulin can be too much and then drastically bring down the sugar level, which can lead to another serious problem. So random blood sugar will help addressing that particular problem. So when they check the random blood sugar and they see that it is too low, all right, then they can tell them what to do. Usually maybe below 60, below 40, below 80, that will be a problem already. So random blood sugar should definitely be below 140 for normal persons, but not below 80. Okay, whereas fasting blood sugar should be below 100. Okay, while random blood sugar should be below 140 for normal person, 100 for normal person for both fasting and random. All right, so that is that for our videos today. If you have any more questions about diabetes, ensure to mention the question in the comment section and I will address it. Remember to share this video to your loved ones, to your friends. Now let me say this. Now people usually think diabetes is for the old. No, ensure you do your routine blood check, maybe as frequently as once in a year or maybe twice in a year. It's going to help you. Or whenever you feel those symptoms that I mentioned earlier, it's going to help ensure that the diabetes does not progress, because diabetes can be a starter pack for a lot of other diseases, including hypertension, including stroke, including many other kind of complications that can happen in the body. So if you address it at the initial stage, you'll be able to use lifestyle modification and a little bit of drug, and you'll be fine. Or maybe just lifestyle modification can work for you. That's, you just modify what you eat, modify what you do, your activities, so that you'll be able to overcome diabetes in the long run. Also, persons who are overweight can also be predisposed to having diabetes, or if you have diabetes in your bloodline. All right, so if you're overweight, I have a video on how to reduce weight, so just try to check it out. It's quite easy and simple to follow, so you'll be able to fight off most of the weight and then have your insulin not do too much work that is initially supposed to do, but that's already too much. I promise to make this video short, so thank you very much for staying up to this extent. Remember to like, remember to share, and remember to subscribe. See you in my next video. Bye for now.